Okay, good morning. Welcome, Rachel, to How to Give a Clinical Handover to Ambulance Crews. My name is Mike Hanson, and I'm from MH Training.
Yep.
So how to give a clinical handover to ambulance crews. Firstly, you've studied nursing, Rachel. Have you ever had to give a clinical handover to an ambulance crew before?
I have, yes. Not to an
You
ambulance.
have?
Yeah.
Oh, to hospital staff, but not necessarily to an ambulance crew?
Yeah, that's correct.
Okay.
Yep.
Cool. It's a little bit different. You may experience that when you're working in a hospital or even in a private setting. That what they teach you in the nursing course might be a little bit different. I think the acronym, for example, is ISPAR, I believe, that you use, where it's a little bit different with ambulance crews. So that's what this session is to show you how to give a clinical handover if ever you come in contact with ambulance crews, either privately or in a hospital setting.
Okay.
So this session will be about 20 minutes long, and it's been broken up into first a little bit of an instruction, building on your current knowledge that you have as a nurse. So there'll be some aspects and some terminology which you'll be very familiar with. Then we're going to do a couple of practice rounds with some information based on scenarios, and we're going to be able to break it down and provide it as a clinical handover. And then finally, there's a demonstration where, like an assessment, we'll just get you to have a look at a scenario and then be able to break up that information and provide it as a clinical handover. So that's what we'll be doing during this session. Just a couple of safety notes. Obviously, being a Zoom meeting, just to know the venue that you're in and just about your own evacuation procedure, you'll be familiar with where you are and what you need to do in case of an emergency. So if you need to take time to do that now, you can. Otherwise, are you happy and familiar with your venue?
Yes.
Great. The second thing is, obviously, we're sitting in front of a computer. If you ever need to take a break or stretch and unwind or go to the bathroom, just let me know and we can pause to do that.
Okay.
And thirdly, this being a recording, just regarding security, this will only be accessed by you, by your employer, and of course, MH Training, it'll be stored there as well if ever you need it in the future.
Okay.
Okay. So first thing that we'll do is, why is it important to know how to give a clinical handover? Firstly, decisions in a medical emergency may be guided by the information that you provide in a handover. That information will be vital to crews to draw on if ever they need to, if a patient deteriorates, for example.
Yep.
Secondly, communication failures, they're a major cause of adverse events in clinical settings. Having incorrect or incomplete information may result in a different treatment path or something not being done that could have an adverse impact on the patient. And thirdly, as a health professional, we have a duty of care to provide accurate and sometimes very urgent information regarding the patient.
Yep.
So when, sorry, Rachel, have you got a question?
Oh, no, that's okay. Yep.
No. Okay. So when do we give clinical handovers to ambulance crews? So the first time is when you're in a hospital setting and your patient is being transferred to another hospital. Secondly, when a patient is being discharged home and they might be being taken home by an ambulance crew if there's some mobility issues. And thirdly, when you're handing over to an ambulance crew in an emergency or an accident, so this is talking about in your private everyday life, you may come across an accident, hopefully not involved in it, and an ambulance crew is attended and you need to give a handover to them. So you'll find this hopefully very useful to do that, because ambulance crews will take note about the information you give, and if it's in the correct format and order, then they'll take notice. They will definitely take notice if you present the information the way they are looking to receive it. So an effective handover, it needs to be confident and succinct. So you need to be very sure of the information you're giving and to basically condense it down just to the information that they will need. Secondly, it needs to be assertive and loud. This would be more if you're in a hospital setting and you may be surrounded by a number of staff. You may have doctors and other allied health standing nearby, and you need to project your voice so they can all hear you. And thirdly, most importantly, it needs to be structured, and that's to make sure that all the relevant information is attached and is there for the handover. And number 4, no information that is irrelevant should be in a handover. And lastly, it needs to be congruent with the documentation. So if you're working in a hospital and there's all of the patient information there, the handover you give does need to be in line with the information that's in the document and not be conflicting, because that can cause issues. So we're talking about the structure in particular in this lesson, and ambulance crews throughout Australia all use the same format, and it's IMIST AMBO, IMIST AMBO. Now, the order that this is given is not vital, but the content is. As long as this is covered, the order that you provide, it doesn't necessarily have to be this, but this is all the information they will be looking for. So I firstly is identify the patient. So you're looking at their name and their age. M is for the mechanism or the medical complaint. So, for example, mechanism may be a fall. The mechanism could be a vehicle accident. Where the medical complaint can be, say, the patient is suffering pain. I is for the injury or the information relevant to the complaint. So this is sometimes more of a hospital setting. An injury may be they have a fractured arm, for example. That would be the injury. S is for the vital signs. Now, you'd be familiar with this, Rachel, being in nursing. The vital signs, of course, we know relate to things like the heart rate, blood pressure, blood sugar levels, oxygen saturation, things like that. That's what the vital signs refer to. Mm-hmm. T is for treatment and trends. So the treatment is what treatment has been provided by you or in a hospital setting or you privately. So it may be you gave pain relief. It may be that you just supported someone's fracture. It might be that nurses at a hospital provided a bolus of fluid, for example. That's the treatment and trends. A is for allergies. Of course, that's very important to ensure that a patient never receives a medication or a food that could that they're allergic to, that could cause anaphylaxis, for example. M is for medications, and that relates to their regular medications that they take. And B is for background, so any other medical history that that person may have. And O is for any other information, so it may relate to their social situation, NFR, which you may know as a not for resus order, if there's anything like that. It may involve their luggage or their belongings, anything else extra that may assist with identifying or knowing information about that patient. So what we'll do now is we'll just look at a practice scenario. We'll do a couple of these just to get an idea. So this is a scenario. So picture you're driving home from work and you come across this poor little character who's fallen off his bike and he's sitting by the side of the road. And the interesting thing about these, Rach, is if you haven't already, or you may have already, but this happens, hey, at some point you'll end up being the first person on scene and you'll end up talking to ambulance crews.
Yep.
And it's very important. Now, this information might be something that you've extracted from the person. It might be information that they've told you. So this is the scenario. So John fell off his bike onto his arm. His mum is on the way. His heart rate is 78 beats per minute. He's got a bit of tingling in his fingers. John's 10 years old. And he can't take Panadol. He suffers dizzy spells, but he doesn't take any medication. So you decide to sit with him and you support his arm until the ambulance crew arrive. And very shortly after that, you hear the sirens and the ambulance crew arrive and you're required to give a handover to them. So using the IMIST AMBO acronym, we just extract that information and place it in that order. And it would be like this. So to identify the patient, well, he's John and he's 10 years old. The mechanism of the injury is he fell off his bike onto his arm. The injury is he has pain in his left elbow and he's got tingling in his fingers. We can't determine if he's had a fracture yet. That's something in X-ray. So the injury is just more about what he's sort of experiencing, what he's suffering. The signs, well, all we have is his heart rate is 78, and you could have palpated his wrist to take that. It's about all you really could take by his GCS. The treatment is you supported his arm until the ambulance crew arrived. The allergies, he's allergic to Panadol, and the medications, he doesn't take any. And but his background is he does get dizzy spells sometimes. That could impact what the ambulance crews will look at or what hospitals will look at, the cause of him falling off the bike. Another information is you can inform the paramedics that his mum is on the way.
Okay.
Does that make sense, Rachel, how we've lined up the information using that acronym?
Yes.
And delivered it that way? Okay.
Yep.
So here's another scenario. This will be more of your setting when you're working in hospital, and you may have done this already. So you've got a patient that's being transferred to the Royal Melbourne Hospital. And this is some of the information that we know about the patient, and then we'll break it down and provide it as a handover. So Sandra has an appendicitis. She has pain in her lower right quadrant, and she's had nausea for 3 days. Her blood pressure is 124/60, and her husband will meet her at hospital. The heart rate is 80. The doctors gave her 10 milligram of IV morphine and 4 milligrams on danzatron and a 2-litre bolus of saline. Her pain currently is 0 out of 10, which is great. She's 30 years old and suffers hypertension and reflux, which she takes Nexium and Perindopril for. And she's allergic to tramadol.
Okay.
So the ambulance crew arrive at the hospital and they're standing there next to you and they're ready to receive the handover before they take this patient onto the Royal Melbourne. And your handover using the acronym could look like this. So identify Sandra, she's 30 years old. The mechanism is she has lower right quadrant pain and she had nausea for 3 days. That's the mechanism or the complaint. The injury, we know it's been diagnosed as an appendicitis. Her signs, her heart rate is 80 and her blood pressure was 124/60. And the treatment provided in hospital was she had 10 milligrams of morphine IV, 4 milligrams of ondansetron, and 2-litre saline bolus, and she currently has 0 out of 10 pain. Sandra is allergic to tramadol, and her medications she takes is Nexium and Perindopril, which she takes for her reflux and her hypertension. And her husband is going to meet her at the Royal Melbourne when she gets there.
Yep.
Does that make sense?
Yes, it does.
Okay, cool. Awesome. Do you have any questions so far, Rachel, about providing the handover using this acronym?
So other information can be anything at all?
Absolutely. Anything you think that's relevant to the handover to the crew.
Okay.
That's right. So it can literally be anything that'll assist them in caring for that patient.
Okay.
So great. So just to recap, so using I, Miss Dambo, I is for identify, the name and age. M is the mechanism, medical complaint. I is for injury. S is for the signs. T is for the treatment and trends. A is for allergies. M is for medications. B is for background. And O is for any other information.
Yep.
Okay. Okay, what we might do is just take a quick break, just stretch your neck. If you need to hop up and grab a drink or go to the bathroom, we'll just do that.
Okay.
Otherwise, we can continue if you're okay.
Yep, we can continue.
Oh, great. Okay, so what we're going to do now, Rachel, is we'll just get you to demonstrate your understanding of giving a clinical handover.
Sure.
Given this scenario, and we will go through it together.
Okay.
So
yep.
You're going to visit your grandmother. Just so your grandmother looks like that, but
yep.
She looks like a lovely grandmother. And you notice she's on the fall. So Nancy, she fell over and she's landed on her shoulder. She's 80 years of age. She lives alone. Her shoulder is very painful. She has hypertension and gout, and she's allergic to penicillin. You tell her to stay on the ground, just to stay where she is until the ambulance crew arrives. She normally takes metoprolol, which is a beta blocker for hypertension. Her heart rate, you palpate her wrist, and her heart rate is 82, and her GCS is 14, which is normal for Nancy, unfortunately. So that's the information. On the next slide, I've got that information still there, so you can use that. And what we might do now, if with a paper and pen, is just to jot down that information in the IMIST-AMBO format.
Okay.
And then we'll go through it together. So I'll just give you a few moments to do that.
Okay, sure. Okay.
Just let me know when you're done.
Yeah. Okay. Okay. All right. I think I'm
okay. How did you go? You good?
Okay.
Oh, fantastic. Well, very great. So what I'll do is I'll flick to the next screen and we'll go through these together, and then we'll look at if what you indicated was correct.
Okay.
Okay. So looking at this.
Yep.
So Nancy was 80 years old.
Yep.
She fell. The mechanism she fell over and she landed on her shoulder.
Yep.
She has pain in her shoulder. The
Yep.
signs is her heart rate is 82 and her GCS is 14.
Yep.
As you asked her to stay still where she is until the crew arrive.
Yep.
Her allergies, she's allergic to penicillin, and her medications she takes metoprolol. Her background is she suffers from hypertension and gout, and just some other information is she lives alone.
Yes.
Did you get those indicated correctly?
I did, but I made a mistake with the T.
Oh, that's okay. Yeah, so what did you have down for T?
I put the medication for T.
Okay. Yeah, sure, that's okay. So we'll pop that under M for the medication, but that's very good. So does that make sense and seem like a fairly easy sort of procedure to follow when providing a handover?
Yep, it does.
Fantastic. That's great.
Okay.
So that's pretty much for our lesson for today. So during this lesson, you've learned how to give a clinical handover to ambulance crews. You've learned why we give handovers and how we give a handover using the IMIST-AMBO acronym.
Yep.
We've shown examples and we've assessed you, given a scenario and the format, used it to format into the IMIST-AMBO. And of course, with that assessment, I think it's fantastic how well you did, and I'm very happy with the results that you've provided with that, Rachel.
Okay, that was a really good session.
Thank you. Well, thank you very much for attending. I've made a little flashcard for you to take. You can keep in your nurse's pouch at work, or if you keep it on you in your car. I will send you an email with some feedback. If you wouldn't mind filling that feedback in and just returning via email.
Okay.
Just remember to practice in the future. It will make yourself get very good at it.
Yep.
And the information will help you in your career. And of course, if you need any more information, I'm contactable on that email, mike_mhtraining.org, and there's my mobile number as well. But thanks very much, Rachel, for attending today's session.
Okay, you're welcome. Thank you. That was a really
Thank you.
informative session.
That's great. You have a good day. Thank you.